Hello everyone and good day, and welcome to our first online seminar or discussion about first aid kit and first aid provider. I am your host for today, Kate Sikal Palaed, and thank you for giving us an opportunity to share our knowledge in first aid kit and first aid provider. And I hope we will give you the best presentation about this topic. In today's discussion, our topic for today are topic number 1, Introduction of First Aid. Topic number 2, Components of First Aid. Topic number 3, Procedures for any emergency. Number 4, First Aid Kit. Number 5, First Aid Provider. And lastly, Responsibilities of First Aid Provider. The first presenter will discuss about the topic number 1 and topic number 2 by Kathleen C. De Auna. And after which, the next presenter will discuss the topic number 3 by Eden Jackie Tinasa. And the next presenter will also discuss topic number 4 by Jerome Aguliana. And for the last two topics are discussed by yours truly, Kate Sicolai.
A first aid kit is a collection of supplies and equipment that is used to give medical treatment. So, first aid kit ay isang gawain na mahalagang matutunan ng bawat isa sa atin. Ito ay isang epektibong paraan upang ang isang tao na nadisgrasya o may naranasang hindi maganda ay maging ligtas sa tiyak na panganib tuwing oras ng kagipitan. Components of first aid kit. Wound dressing. Dressing pads attached to a roller bandage are the most useful bandage. They are easy to apply and so are ideal for emergency. Types of wounds. Sterile wound dressing, sterile eye pad, sterile pad, fabric plaster, waterproof plasters. Adhesive dressing or platters. These are made from fabric or waterproof plastic and can be applied to small cuts and grazes. If you work with food, you will be required to use blue platters. Gel platters can be used to protect blisters. Type of adhesive dressing or platters include clean plasters, blue Catherine plaster, gel blister plasters. Bandage, roller bandage. These are used to support injured joints, limit swelling, maintain pressure on wounds, and secure dressing in place. Types of rolling wounds include conforming roller bandage, open wave roller bandage, support roller bandage, self-adhesive bandage. Triangular bandage. These are made of cloth, can be folded to make bandage or slings. If they are individually wrapped and sterile, they can also be used as dressing for large wounds and burns. Tubular bandage. Gauze tubular bandage is used to secure dressing on toes and fingers and is applied to the injury with a special applicator. Elasticated tubular bandage can be used to support injured joints such as elbow or knees. Protective items. Disposable gloves. If available, gloves should be worn whenever you dress wounds, handle bodily fluids, or other waste material. Protection from infection. A plastic face shield or pocket mask can be help protect you from cross-infection with a casualty when giving rescue breath. Additional items. Cleaning wipes to clean the skin around the wound. Gauze pants to use a padding or a swabs to clean around the wounds. Adhesive tape to hold dressing in place or to hold the loose end of bandage. Scissors Used to cut bandage or sticky tape or someone's clothing if you need to get a wound. Pins and clips to fasten loose ends of bandage. Aluminum blanket used to help retain body heat in survival emergency and first aid situation.
Good morning everyone, I'm Ethan Jakitinaza, a BSMB1 student, and I am here to discuss to you the procedures of any emergency first aid. Procedures for any emergency first aid. Here are 10 first aid must-knows that you can use to treat a broad array of injuries. Number 1. Remember the 3 P's. Number 2. Check the scene for danger before you provide help. Number 3. To treat cuts and scrapes, apply gentle pressure, disinfectant, and bandages. Number 4. To treat sprains, apply ice and compression at intervals and keep the limb elevated. Number 5. To treat heat exhaustion, use cool fluids, cool cloths, and shade. Number 6. To treat hypothermia, use warm fluids and warm covering. Number 7. To treat burns, determine the burn type and severity. Cover the wound with loose cloth to prevent infection. Number 8. Use an EpiPen to treat allergic reactions. Number 9. To treat fractures, keep the fractured area stable and immobilize and apply a cold pack. Number 10. Last but not the least, perform CPR if an injured person is stopped breathing. It's important that you commit these 10 golden rules to memory. Even if you're not injured, you might encounter someone who is and who needs treatment. Always attempt to seek professional actions. Number 9. To treat fractures, keep the fractured area stable and immobilize and apply a cold pack. Number 10. Last but not the least, perform CPR if an injured person is stopped breathing. It's important that you commit these 10 golden rules to memory. Even if you're not injured, you might encounter someone who is and who needs treatment. Always attempt to seek professional medical help for injured persons. First responders are not always readily available during emergency situations. And if that's the case, do your best to provide the treatment you can until help arrives. But never forget that serious injuries always require more advanced treatment, and you should do your best to get the injured person to professional caregivers. Nonetheless, these simple first aid procedures can go a long way in helping someone who's injured. And all you need to do is use a few materials in your survival kit and apply them in the right manner. Number 1. Let's discuss the procedures for any emergency first aid. Number 1. The 3 P's. The 3 P's are the primary goals of a first aid, and that is preserve life, prevent further injury, and promote recovery. These goals might seem overly simple, but they're simple on purpose. When someone is injured, it's all too easy to panic and forget what you need to do is to provide assistance. The 3 P's remind you of the very basics. Do what you can to save the person's life. Do what you can to keep them from sustaining further injuries. And do what you can do to help them heal. Number 2. Check the scene for danger. Before you provide help to an injured person, it's important that you check the scene for danger. You don't want to get yourself injured too. This isn't a cowardly precaution. The fact of the matter is this: if you get injured too, you won't be able to help someone else who's injured. So before you rush to help someone, take a moment to analyze the area and spot anything that could injure you. For example, there might be a terrible storm outdoors and you spot someone outside who's injured and who cannot make it to shelter. Before you go running outside to help them, look for hazards. Are strong winds hurling debris? Are there any trees or structures that look as if they're about to fall? Are there down power lines? Is there flood water? Once you have assessed these dangers, you can better strategize how to reach and rescue the injured person. Number 3, treating cuts and scrapes. Blood is a vital component of our bodies. When someone is bleeding, you want to prevent as much blood from leaving their body as possible. Try and find a clean cloth or bandage. Then apply gentle pressure for 20 to 30 minutes. Clean the wound by gently running clean water. Then after that, avoid using soap on open wound. Apply antibiotic to the wound like Neosporin. Cover the wound with a bandage. If someone has a nosebleed, have the person to lean forward. Press a cloth against the nostrils until the blood flow stops. The body is usually very quick at patching up small cuts and scrapes, but deeper wounds may require medical attention with deep wounds. Apply pressure. Don't apply ointments. Cover the area with loose cloth to prevent contaminants from infecting the wound. Seek medical attention as soon as possible. Number 4, treating sprains. Sprains are usually an alarming injury, and most of the time they'll heal on their own, but there are steps you can take to ease the swelling. Swelling is caused by the blood flow to an injured area. You can reduce swelling by applying ice. Ice restricts the blood vessels, which reduces blood flow. Keep the injured limb elevated. Apply ice to the injured area. Don't apply ice directly to the skin. Wrap it in a cloth or put ice in a plastic bag. Keep the injured area compressed. Put it in a brace or tightly wrap it. Don't wrap it so tight that it will cut off circulation. Ice for a while, then compress. Repeat at intervals. Make sure the injured person avoids putting weight on the injured limb. Then number 5, treating heat exhaustion. Heat exhaustion occurs due to prolonged exposure to high temperatures, especially when the person is doing strenuous activities or hasn't had enough water. Symptoms of heat exhaustion include cool, moist skin, heavy sweating, dizziness, muscle cramps, nausea, headaches. To treat someone with heat exhaustion, get the person to a shaded area that's out of the sun. If there are no shaded areas available, keep the person covered by any available materials that can block sunlight. Give the person water and keep them hydrated. And last, place a cool cloth on their forehead to lower their body temperature. Number 6, treating hypothermia. Hypothermia is caused by prolonged exposure to cold temperatures. It begins to occur when your body temperature drops below 95 degrees Fahrenheit. Symptoms of hypothermia include shivering, slurred speech or mumbling, weak pulse, weak coordination, confusion, red, cold skin, or loss of consciousness. To treat hypothermia, be gentle with the afflicted person. Don't rub their body and don't move their body into jarring of a weight. This could trigger cardiac arrest. Move the person out of the cold and remove any wet clothing. Cover the person with blankets and use heat packs. Don't apply heat directly to the skin because this could cause major skin damage. Give the person warm fluids. If you set the person on the ground, be aware that the ground may also be a cold source. Place warm materials on the ground that the person going to lay on. Number 7. Treating burns. Before you apply treatment to burns, you need to identify the burn type and the severity of the burn. There are 4 kinds of burns. First degree burn, only the outer layer of the skin are burnt. The skin is red and swollen and looks similar to a sunburn. Second degree burn, some of the inner layer of the skin is burnt. Look for blistering skin and swelling. This is usually a very painful type of a burn. Third degree burn, all of the inner layer of skin is burnt. The wound has a whitish or blackened color. Some third degree burns are so deep. There might not be any pain because the nerve endings are destroyed. Fourth degree burn, a burn that has penetrated all tissues up to the tendons and bones. Additionally, there are 2 kinds of burn severities, a minor burn and a major burn. Minor burn, first degree burns and mild second degree burns. Major burn, moderate second degree burns to 4th degree burns. Minor burns don't usually need extensive treatment, but you could run cold water over the afflicted area or avoid icy or very cold water. Don't break any blisters. Apply moisturizer over the area like aloe vera. Keep the burned person out of the sunlight. Have the burned person take ibuprofen or for pain relief. Major burns are very serious injuries that require medical assistance. To help someone who has suffered from a major burn, do not apply ointment. Cover wound with loose materials to prevent contaminant from infecting it. Number 8. Allergic reactions. Allergic reactions occur when your body is hypersensitive to a foreign substance. Bee stings, certain foods or drug ingredients can cause allergic reaction. Anaphylaxis is a life-threatening allergic reaction that can be caused by all of those mentioned allergens. The best way to treat an allergic reaction is to use an EpiPen or epinephrine auto-injector is a small ergonomic needle that used to inject epinephrine adrenaline into someone suffering greatly from an allergic reaction. It usually subduces the effects of the allergic reaction. If someone is suffering from an allergic reaction, keep the person calm, ask if they use an EpiPen and have one with them. Have the person lie on their back, keep their feet elevated 12 inches, make sure the person's clothing is loose so they're able to breathe. Make sure avoid giving them food, drink, or medicine. If appropriate, use an EpiPen. Learn how to inject an EpiPen in someone having a reaction. Wait 5 to 15 minutes after using an EpiPen. If the allergic reaction isn't subdued, a second dose may be required. Number 9. Treating fractures. Sometimes it is very easy to tell if someone has suffered a fractured bone, but sometimes it's not. If you suspect someone of having a fracture, don't try to straighten a fractured limb. Use a splint or padding to stabilize the area and keep it from moving. Apply a cold pack to the area. Don't apply it directly to the skin. Wrap it in a cloth or put it in a plastic bag. Keep the area elevated if possible. Give the person an anti-inflammatory drug like ibuprofen. And number 10, last but not the least, performing the CPR. CPR stands for cardiopulmonary resuscitation. CPR is used to restore breathing and blood circulation to an unresponsive person. CPR is an incredibly important procedure that can save lives. But learning CPR is an intensive procedure that requires some training, which is usually in the form of a day-long class. The American Red Cross offers CPR certification classes across the nation. Go to the redcross.org for more information about the CPR. And that's it. That's for the procedures for any emergency first aid. Prepare yourself with the right gear. The methods listed above are not very difficult to do and don't require medical training, but they can save someone's lives or prevent an injured person from sustaining serious injuries or infections. Make sure that your stash of survival gear includes a first aid kit, and be sure to refill your first aid kit every year as its supplies dwindle or expire. The essential first aid kit you should include in your first aid kit is antibacterial wipes, painkillers, gauze pads, sunscreen, medical gloves, medical instrument kit, sling, burn gel, antibiotic ointment, antiseptic wipes, first aid instructions, tourniquet. That's all. Thank you for watching.
Definition of first aid kit. A first aid kit, a collection of supplies and equipment that used to give medical treatment. There is a wide variation in the content of first aid kit based on the knowledge, experience, and those putting it together, and the differing first aid requirements of the area where it may be used, and variation, allegation, or regulation in the given area. Here are the top 10 absolute must-have medical supplies remote medical international instructors carry in their kits. Number 1, gloves eye protection. Number 2, CPR pocket mask. Number 3, tourniquet. Number 4, roller gauze. Number 5, 4x4 gauze pads. Number 6, medical tape. Number 7, 2 triangular bandage. Number 8, some split. Number 9, elastic bandage. Number 10, thermal shears.
First aid provider are someone trained in the delivery of initial emergency procedures, using limited equipment to perform a primary assessment and interventions until ESM personnel arrive. The responsibilities of a first aid provider act as a bridge that fills the gap between the victim and the physician, recognizing a medical emergency, making the decision to help, identifying hazards, and ensuring personal safety, activating the EMS system, providing support, basic first aid care. The goal of this training is to help a provider gain the knowledge, skills, and confidence necessary to manage a medical emergency until more advanced help is available. And every provider need to have patience with the victim, gentle, empathetic, and respectful to each of them.